Mr. Luo Dapeng is WHO's country representative in Pakistan. He's joining us today from Islamabad. We'll ask him about Pakistan's efforts to end the polio program and also ask him about WHO's support for Pakistan in eliminating endemics inside the country. Thank you so much for joining us. If we could start with the issue of global health funding, which has taken a hit in the last couple of years, including WHO's own budget. How's that actually affecting your ability to support a country like Pakistan? One that's this close to eliminating diseases the rest of the world's already gotten rid of.
Thank you for your question. It is true the world is going through a period of financial constraint for international cooperation. However, despite the challenges, people we serve can be reassured. The WHO, the World Health Organization, will continue delivering and partnering with Pakistan and its people to bring medical science to every family without exception, regardless of social and economic status. Regarding the question related to how WHO delivering, please allow me to give just a few examples of how WHO Pakistan teams has delivered in 2024 and 2025 biennials. For instance, WHO partnered with Pakistan so our 1 million people can benefit from primary care oriented model care in 3 districts. We also support the development of 45 million children. The vaccination of close 48 million children, women and girls through routine and specific campaigns. Provision life-saving treatment of 138,000 children affect severe acute malnutrition with medical complication. The distribution of 887 metric ton of medical supply equipment and the vaccination of 45 million children against polio multiple times a year throughout 14 large-scale house-to-house campaign. In addition to additional target drive for reach millions of people in transit, WHO also support delivery improve reproductive, maternal, newborn, child, adolescent health care for our 5.5 million people. This is just a few examples. But in WHO, we believe we need to continue advance toward the goal of deliver health for all, building a healthy, therefore stronger future for Pakistan and its people. I think every national and international partner understand the invest in public health and leaving no one behind is not only the right thing to do, but also smartest and most cost-effective decision. For instance, every dollar invested saves $25, avoid outbreak costs and treatment of paralytic diseases. Immunization return $54 for every dollar invested and build a future prosperity and health security. Every dollar invested in maternal child can deliver up to $20 in economic gains. Health emergency preparedness save lives, can also save millions of dollars by preemptive cost emergency response.
So with funding tightening everywhere else, how solid is the financial footing under Pakistan's health programs for the next 2 or even 3 years?
As I said before, what we can assure that WHO will continue stand with Pakistan and its people, delivering with a solid investment case for 2026 and 2027. We see strong commitment of the government of Pakistan, many international partners and donors. They all understand that the investment in public health is not a luxury, but necessary to step to ensure a more prosperous presence and future, not only for Pakistan, but for the region and for the world. The reason is very simple. Medical science and evidence has proved on multiple occasions. When it comes to public health, no one is safe until everyone is safe.
About polio, Pakistan's brought down polio 99.8% since the 90s, but your own regional director called the next 6 months critical for finally stopping transmission for good. Pakistan and Afghanistan are the last two countries left with the endemic. So what actually has to go right in this window for that to happen this year?
As our regional director said, indeed, next 6 months will be critical for taking decisive steps toward goal or interrupt polio transmission. Pakistan is showing strong commitment and leadership to eradicate polio. All evidence indicate Pakistan achieved significant progress. But answer your question, what are necessary steps to run the last mile and eradicate polio forever? I believe Pakistan and all partners are doing an extraordinary job. It will be essential we will maintain the intensity of polio response, reaching every children no matter where they are, and continue based on polio operation on medical science, evidence, and a strong surveillance network. To success, the rural area has front-line workers and support engagement of every community to protect our children from this paralytic disease will be essential. This also means family to ensure that children receive all the routine immunization, including polio. We will be able to eradicate polio if we do it together. Now we have a historic opportunity to end this terrible disease for good. We can do it. We must do it for our children and our grandchildren.
Pakistan is still hosting around 0.8 million documented Afghan refugees, according to UNHCR, plus host communities getting emergency health support. How is Pakistan managing that burden, and what does WHO actually need from international donors to keep it sustainable?
In 2024 and 2025 biennium, WHO worked with Pakistan as partners, provided emergency health assistance to our 4.8 million Afghan refugees. WHO principles are clear. We are always going to be there to deliver health for all, particularly for most vulnerable, no matter where they live, who they are. And we also encourage every donors to continue investing in public health, because by investing in public health, we all win and continue building more prosperous world.
Say Pakistan does stop polio virus transmission this year. What would that really mean for Pakistan standing globally and for the rest of the world?
Stopping polio virus transmission would be fantastic. A much needed good news for the world. It would mean a big step for finally eradicating polio, although, as you may know, we need to ensure the virus never come back, going through a strict verification and certification process to confirm polio has been eradicated in Pakistan, in the region, and worldwide. Ending polio would mean, as a humanity, we would have successful in eradicating second disease in history, following eradicate a terrible disease like smallpox in 1980s. And the polio could save millions or if not billions dollars for Pakistan and the world. It will unlock so many opportunities for resources and capacity and access could be directed to support other parts of the public health system in the country and globally. And the polio could means every child in Pakistan, in the region, in the world, will have a chance for a healthy and better future without threat of terrible paralytic disease. And the polio means a stronger, a more prosperity future for Pakistan, for every Pakistan family.
So beyond polio, you are reaching close to 48 million children, women and girls with life-saving vaccines a year and deworming 45 million school-age kids. Where do you see Pakistan's primary healthcare system genuinely making progress right now outside the polio program?
Our last year, Pakistan, as a founding member of the WHO World Health Organization, has been continuously strengthening its commitment to promote public health, to fulfill international commitment related to health. Precisely, primary health care has been prioritized by government of Pakistan over last years. It has been increased national health and population policies. Pakistan has expanded universal health coverage to additional 51 million people over last decade, from 87 million in 2015 to 138 million in 2023. The 2025 Global Monitoring Report launched by WHO, the World Bank, indicated that Pakistan increased service coverage index from 40 in 2015 to 56 in 2023. Although challenges remain and intensify, concerned effort will be required to meet a global target of 80% to 2030. Let me also share some examples among many of Pakistan achievement in public health. Following WHO eradication of the elimination of maternal and neonatal tetanus in KP, Pakistan is close to interrupting transmission of life-threatening disease among mother and neonatal born nationwide. Among 84% of Pakistan population, or approximately 250 million people, now live in the area where spread of neonatal tetanus remain under controlled limits. Less than one case of tetanus per 1,000 living births.
You've got sub-offices everywhere from Peshawar to Gilgit-Baltistan to Muzaffarabad, which can be a difficult terrain. What's actually surprised you about what it takes to deliver basic healthcare in Pakistan's most remote corners?
I have had chance to travel across country, and every field visit, what I always surprised is resilience, the kindness, the solidarity or dedication Pakistani health frontline workers who bring medical science to every community and who every day work extremely hard to protect and save life. They are our real heroes.
Mr. Dapeng, thank you so much for joining us.